Hi everyone. In this video, we're diving into Max Weber's concept of rationalization as discussed in essays in sociology and seeing how exactly it plays out in something close to all of us, the healthcare system. Weber describes rationalization as a defining feature of modernity. It's the process by which traditional and emotional ways of thinking are replaced by logic, efficiency, and control. In modern societies, we rely more on rules, procedures, and calculations, which is what Weber calls instrumental reason, to organize everything from businesses to governments and even human relationships. This shift sounds like progress. In many ways, it is. But Weber also warned of the iron cage, a system so focused on efficiency that it traps individuals in a world of rules, stripping life of spontaneity, freedom, and meaning. Let's look at healthcare. Hospitals and clinics are prime examples of rationalized institutions. Think about it. There are electronic health records, diagnosis codes, appointment systems, doctor use standardized checklists and treatment protocols, and insurance companies approve procedures based on cost benefit analysis. These structures make care more efficient and scalable. But what happens to the human side of medicine? Weber would argue that we risk turning patients into numbers and doctors into bureaucrats. The goal becomes managing health data, not healing whole persons. One way we see the iron cage in action is the end of life care, where economic efficiency directly shapes moral decisions. In his 2014 article, Economics of Dying, sociologist Roy Livney explores how U.S. hospice care negotiates between moral values and economic limitations. Hospice workers constantly balance compassionate care with pressures to reduce costs, manage beds, and adhere to medical regulations. As Livney shows, even death gets managed within a rationalized system. Care becomes a calculation. How much is too much to spend on a dying patient? Is it rational to continue aggressive treatment when it's unlikely to help? These questions reflect not just medical concerns, but economic and bureaucratic ones too. Max Weber argued that rationalization transforms not just our institutions, but even our most intimate experiences. A powerful example of this can be found in Roy Livney's study of hospice care in the US. Livney shows how decisions about dying are no longer left solely to doctors or families. Instead, they're shaped by Medicare rules, eligibility criteria, and financial audits. The system decides who qualifies for care based on prognosis models, not human judgment. If a patient lives too long, it raises red flags for auditors. Caregivers are forced to align their emotional labor, comforting, listening, supporting, with strict timelines and cost efficiency expectations. As one hospice worker put it, we want to do the right thing, but we have to think about the numbers. The result? Well, families tend to lose autonomy, death also becomes standardized, and even grief is shaped by bureaucratic logic. This is rationalization at work. It's deeply efficient and deeply unsettling. Sociologist Ava Illouz shows that even our most intimate feelings, like love, are no longer untouched by rational systems. In her work, she explains how love has become structured and managed. Dating apps use filters and algorithms to optimize romantic connection. Therapy is broken into performance goals, sessions, and outcomes, turning emotional development into something trackable and time bound. So, what does this have to do with medicine? A lot. Like love, healthcare becomes less about deep human connection and more about measurable, structured interaction. It's not just how we feel, but how our feelings fit into pre approved systems, whether that's a 50-minute therapy session or a doctor with a tablet checking boxes. As she puts it, we are expected to perform our feelings rationally. And that expectation isn't just for relationships, it's embedded in how we experience illnesses, care, and even dying. While rationalization can make systems more efficient, it often strips away the emotional, moral, and spontaneous aspects of human life. In healthcare, this means faster intake processes and better cost control. But also, patients who feel like data points and families can get caught up in rigid timelines. The balance between efficiency and humanity becomes harder to maintain. So, this is one critique that can be found. Rationalization is one of the most important forces shaping our world. It brings clear advantages, efficiency, and predictability, as well as order. But it also makes us ask tough questions. What are we giving up? How do we preserve emotion, meaning, and freedom in a rationalized world? These aren't just academic ideas, they affect how we live, love, and even how we die. Thank you so much for watching.